Going to the doctor is fun. Well, okay, at least for me. I might be alone in that because I literally have the best doctor in the world, but whatever. I like the doctor. I like knowing what's going on in my body, but some people don't. And after years of avoiding their health provider, they may find something terrifying laying in their test results. Hi, I'm V, and these are the top 5 unsettling medical anomalies that will leave you disturbed. Number 5, Brewery Syndrome. Brewery Syndrome, ABS, also known as gut fermentation syndrome, is a rare medical condition characterized by the spontaneous and excessive production of alcohol within the digestive system. This condition leads to individuals experiencing symptoms of alcohol intoxication without consuming alcoholic beverages. The primary cause of brewery syndrome is an overgrowth of yeast in the gastrointestinal tract. This yeast ferments carbohydrates into ethanol, resulting in elevated blood alcohol levels. Factors contributing to ABS include a weakened immune system, prolonged use of antibiotics, and imbalances in gut flora. Individuals with ABS often exhibit classic signs of alcohol intoxication, including slurred speech, impaired coordination, and altered mental status, despite abstaining from alcohol consumption. ABS may present with gastrointestinal symptoms such as bloating, abdominal pain, and diarrhea, further complicating the diagnosis. The fermentation process can lead to rapid sugar consumption, causing episodes of hypoglycemia, which may manifest as weakness, dizziness, and confusion. Accurate diagnosis involves measuring blood alcohol levels during episodes of suspected intoxication. Elevated blood ethanol levels in the absence of alcohol consumption support the diagnosis of brewery syndrome. A carbohydrate-rich meal may be administered to trigger alcohol production in the digestive system, allowing for observation and measurement of blood alcohol levels. The primary treatment approach involves antifungal medications to suppress the overgrowth of yeast in the gastrointestinal tract. Avoiding factors that contribute to the yeast overgrowth, such as excessive sugar intake and prolonged use of antibiotics, is crucial for managing brewery syndrome. Despite being a recognized medical condition, ABS poses challenges in terms of diagnosis and understanding its prevalence. Controversies surrounding legal implications may arise when individuals with ABS are involved in situations requiring sobriety tests. Brewery syndrome, though rare, highlights the intricate relationship between gut health and overall well-being. Accurate diagnosis and multidisciplinary approach involving medical, dietary, and lifestyle interventions are essential for effectively managing this unique and often misunderstood condition. That one calls for a drink. Medical words are really hard, okay? They're so long. Number 4, Dr. Strangelove's alien hand. Alien hand syndrome, AHS, is a rare neurological disorder that manifests as a disassociation between the individual and one of their hands, resulting in involuntary and seemingly purposeful movements without the person's conscious control. This peculiar condition has intrigued researchers and clinicians due to its unique and perplexing nature. The main symptom of alien hand syndrome is the uncontrollable movement of the affected hand, often appearing as if it had a mind of its own. These actions can range from simple automatic movements like grasping objects to more complex behaviors such as unbuttoning shirts or even aggressive actions like hitting oneself. Alien hand syndrome is primarily associated with damage to the bundle of nerve fibers connecting the 2 hemispheres of the brain. Other brain regions implicated include the frontal and parietal lobes. The condition is often observed in patients who have undergone surgeries to treat epilepsy or tumors, where the disconnection of brain regions can lead to the loss of voluntary control over the affected hand. This lack of coordination between the left and right hemispheres contributes to the alien hand's seemingly independent actions. The affected hand may engage in actions contradictory to the individual's intentions, creating a surreal and distressing experience for the person. A key aspect of alien hand syndrome is the conflict between the intentions of the 2 brain hemispheres. While one hemisphere may have a specific goal or action in mind, the other hemisphere, due to disconnection, may drive the alien hand to perform conflicting actions. Diagnosing alien hand syndrome can be challenging, as its symptoms may overlap with other neurological conditions. Comprehensive neurological assessments, imaging studies such as MRI or CT scans, and detailed patient history are crucial for an accurate diagnosis. The rarity of the syndrome further complicates its recognition, often leading to delayed or misdiagnosed cases. Managing alien hand syndrome focuses on addressing the underlying neurological issues and helping individuals cope with the challenges posed by the condition. Physical therapy and rehabilitation may assist in improving coordination and reducing involuntary movements. Psychosocial support is also crucial, as individuals individuals with AHS may experience emotional distress due to the alien hand's unpredictable actions. While alien hand syndrome remains a mysterious and rare neurological phenomenon, ongoing research provides valuable insights into the intricacies of brain function and connectivity. Understanding the underlying mechanisms and developing effective management strategies are essential steps towards improving the quality of life for individuals grappling with this disorder. Number 3. Foreign accent syndrome. Foreign accent syndrome, or FAS, is a rare neurological disorder that alters the speech patterns of individuals, making them sound as if they have a foreign accent. This condition is not related to learning a new language or intentional mimicry. Instead, it stems from neurological damage. FAS typically arises as a result of damage to the brain, often affecting the speech and language centers. This damage can be caused by various factors, including strokes, traumatic brain injuries, or neurological conditions. The alteration in speech patterns occurs due to disruptions in the control and coordination of the muscles involved in speech production. The hallmark symptom of FAS is the perceived change in the affected individual's accent. While they may sound as if they are speaking a foreign language, it's crucial to note that the other person usually retains their native language proficiency. Other symptoms may include changes in intonation, rhythm, and speech rate. These alterations can lead to difficulties in communication and may be accompanied by frustration and social challenges. Diagnosing FAS involves a comprehensive assessment by healthcare professionals, including speech-language pathologists and neurologists. Medical history, imaging studies such as MRI or CT scans, and thorough speech analysis help confirm the presence of FAS. It is essential to rule out other potential causes of altered speech, such as psychiatric conditions or deliberate accent changes. FAS cases are exceptionally rare, with only a few documented instances worldwide. Furthermore, the foreign accents observed in FAS are not always associated with a specific country or language. Instead, the altered speech may sound vaguely foreign or mimic accents from various regions. The variability in accents highlights the complexity of the disorder and its relation to the intricate neural pathways involved in language production. Number 2. Proteus Syndrome. Proteus Syndrome, a rare and complex genetic disorder, was first described in 1979 by Dr. Michael Cohen Jr. Named after the Greek sea god Proteus, known for his ability to change shape, this syndrome is identified by excessive tissue growth and asymmetrical overgrowth of various body parts. Proteus syndrome is primarily caused by a spontaneous mutation in the AKT1 gene. This gene provides instructions for producing a protein that regulates cell growth and division. The mutation leads to uncontrolled cell proliferation, resulting in the abnormal tissue growth characteristic of Proteus syndrome. While the majority of cases arise from new mutations, the disorder is not hereditary. One of the hallmark features of Proteus syndrome is asymmetric overgrowth of tissues, bones, and skin. This overgrowth can affect any part of the body and often leads to severe deformities. Individuals with Proteus syndrome may develop benign tumors such as lipomas and vascular malformations. Patients commonly exhibit connective tissue abnormalities, including joint hypermobility and laxity. This can contribute to joint pain, instability, and an increased risk of dislocations. Skin manifestations are prevalent, with elephant man lesions being a characteristic feature. These lesions are typically thick, rough patches of skin that can vary in size and appearance. Diagnosing Proteus syndrome can be challenging due to its rarity and highly variable presentation, depending on each case. Clinical evaluation, imaging studies, and molecular genetic testing are essential steps within the diagnostic process. Identification of the AKT1 mutation through genetic testing is a definitive diagnostic method. Number 1. Anesthetic awareness. Anesthetic awareness is a rare but highly distressing and traumatic phenomenon where patients regain consciousness during surgery. Despite advancements in anesthesia, this occurrence remains a concern for both patients and healthcare providers. Anesthetic awareness refers to awareness of one's surroundings, conversations, or even the surgical procedure itself when patients are supposed to be in a completely unconscious state of general anesthesia. While anesthetic awareness is infrequent, estimates suggest that it occurs in approximately 0.1 to 0.2 of surgeries. Certain factors may increase the risk, such as the type of surgery, the patient's age, and medical history. High-risk surgeries like cardiac or obstetric procedures may elevate the chances of anesthetic awareness. Several factors contribute to anesthetic awareness: insufficient dosage of anesthetic drugs, equipment malfunction, or rapid metabolism of medications can compromise the depth of anesthesia. Miscalculations in drug administration or patient-specific variations in drug response may also play a role. To minimize the risk of anesthetic awareness, anesthesiologists may employ various monitoring techniques, which can help gauge the depth of anesthesia and detect any signs of insufficient sedation. Experiencing anesthetic awareness can have profound psychological effects on patients. They may suffer from PTSD, anxiety, and nightmares. Communicating openly with patients about the possibility of anesthetic awareness before surgery can help mitigate the psychological impact. Preventing anesthetic awareness often involves meticulous monitoring, careful drug administration, and continuous communication between the surgical team and the patient. In cases where anesthetic awareness does occur, prompt recognition and management are crucial. Increasing the depth of anesthesia, administering additional medications, and providing psychological support to the patient are all common strategies. Anesthetic awareness poses legal and ethical challenges in healthcare. Informed consent procedures should include a discussion of the possibility of awareness. In the aftermath of anesthetic awareness, patients may pursue legal action, alleging negligence or inadequate care. While anesthetic awareness remains rare, its potential psychological impact necessitates ongoing efforts to refine anesthesia techniques and monitoring practices. By understanding the risk factors, causes, and preventative measures associated with anesthetic awareness, healthcare providers can work towards ensuring the safety and well-being of patients undergoing surgery. Continuous advancements in anesthesia technology and a commitment to open communication with patients contribute to minimizing the occurrence and consequences of anesthetic awareness in the modern medical landscape. That brings us to the end of today's video. Do you know of anyone who is diagnosed with one of these rare afflictions? Thank you so much for hanging out with me. I hope you enjoyed my rambling, and of course, I hope you learned something. Keep it curious. Bye!